beginning to do a lot of work around understanding not just BCMA directed TCRs, but also some of the other T cell redirected therapies that we're using. Obviously, one of the most obvious resistance mechanism is loss of antigen. The one thing we've seen with BCMA directed treatments is you don't necessarily see a total loss of BCMA, or when the disease comes back, you have BCMA reappearance or resurgence, and you can always treat sequentially with BCMA targeted agents. The data is sort of, is still not that mature, and the numbers are small. And what we have to date demonstrated is if you do a CAR T cell and then follow it with a bispecific or an antibody drug conjugate, patients will still have a response. If you do the converse, though, if you do an antibody drug conjugate or a bispecific and then give CAR T cells, you do not see that much of a response capture, or the durability of response is a lot less. So I think sequencing and antigen loss is something we still need to continue to study. The timing of resurgence of that antigen is really important. There is some evidence to show that there are mutations within BCMA, specifically in the context of bispecific T-cell engagers. Now, the big question there are they acquired mutations, or were these mutations present from the get-go? And more than likely, it was that these are mutations present from the get-go. And with the pressure of therapy, all we're doing is clonally selecting out these clones with the mutations. The jury's still out there, so a lot more work for us to do in this space. As far as GPCR5D targeted agents are concerned, we know that GPCR5D does get down-regulated, the antigen. So I think the work that is being done right now is when does it resurface and how can you treat with some of the GPCR5, because we do have more. You saw data at this year's ASH with the GPCR5D CAR T cell as well, which looked quite promising. So that's something we obviously need to sort out. And then there's a whole host of microenvironmental factors which play into resistance mechanisms. And I think we're just about scratching the surface of our understanding of these mechanisms.